Tension headaches are one of the most common types of headaches experienced by people worldwide. They often start as a mild, dull pain and can gradually intensify if not managed. In this video, we'll explore how tension headaches develop over time, what triggers them, and how they can progress from occasional discomfort to chronic pain. Understanding this progression is key to recognizing early warning signs and taking steps to prevent headaches from becoming a persistent problem. Let's begin by looking at what exactly a tension headache is and how it typically presents in its early stages. A tension headache is characterized by a constant, dull pain or pressure around the forehead, temples, or back of the head and neck. Unlike migraines, tension headaches typically do not cause nausea or visual disturbances. Most people describe the sensation as a tight band squeezing their head. These headaches can last from 30 minutes to several hours, and sometimes even longer. They are often triggered by stress, poor posture, or fatigue. Understanding these basic features helps us recognize the early signs and differentiate tension headaches from other types of headaches. Tension headaches often begin with exposure to certain triggers. Common causes include emotional stress, anxiety, long periods of concentration, or sitting in one position for too long. Physical factors like eye strain from screens, dehydration, or lack of sleep can also contribute. In the early stages, you might notice a slight tightness or discomfort in your scalp or neck. Recognizing these triggers early can help you take preventive action before the headache becomes more severe. At the onset, tension headaches usually present as a mild, nagging discomfort. You may feel a gentle pressure or tightness around your forehead or the back of your head. This discomfort can be easy to ignore at first, especially if you're busy or distracted. However, if the underlying triggers persist, the pain can gradually intensify. Paying attention to these initial symptoms is important, as early intervention can often prevent the headache from worsening. If the initial triggers are not addressed, the pain from a tension headache can slowly build. What starts as a mild ache may become a more persistent, moderate pain. The sensation often spreads from the forehead to the sides and back of the head, and sometimes down into the neck and shoulders. This progression can make it harder to concentrate or relax, and may even interfere with daily activities. Recognizing this escalation is crucial for timely management. As tension headaches progress, physical symptoms may become more noticeable. You might experience muscle tightness in your neck, scalp, or shoulders. Some people report a feeling of heaviness or fatigue, and may even develop sensitivity to light or sound, though these are less common than with migraines. These physical signs are the body's way of signaling that it's under strain, and they often accompany the increasing intensity of the headache. Tension headaches don't just affect you physically, they can also take a toll on your emotional well-being. As the pain persists, you may become irritable, anxious, or find it difficult to focus. Chronic discomfort can lead to frustration and even impact your mood or relationships. It's important to recognize that emotional stress can both trigger and be a consequence of tension headaches, creating a cycle that can be hard to break. Tension headaches can last anywhere from half an hour to several hours, and in some cases, they may persist for days. The duration often depends on the underlying triggers and how quickly they are addressed. For some, the headache may fade with rest or relaxation, while for others, it may linger and recur throughout the day. Understanding the typical duration helps in planning effective coping strategies. Tension headaches can be classified as either acute or chronic. Acute tension headaches occur occasionally and are often linked to specific stressors or events. Chronic tension headaches, on the other hand, happen more than 15 days a month and can last for hours or even be continuous. Chronic headaches are more likely to interfere with daily life and may require more comprehensive management strategies. When tension headaches become frequent and last longer, they can transition from acute to chronic. This shift often happens gradually, as repeated exposure to triggers like ongoing stress, poor posture, or lack of sleep causes the headaches to occur more often. Over time, the pain may become a regular part of daily life, making it harder to function normally. Recognizing this transition early is important for seeking appropriate treatment. Muscle tension in the neck, shoulders, and scalp plays a significant role in the development and persistence of tension headaches. Prolonged muscle contraction, often due to stress or poor posture, can restrict blood flow and increase pain sensitivity. Over time, this muscle tension can become habitual, making headaches more likely to recur. Addressing muscle tension through relaxation techniques or physical therapy can be an effective way to break the cycle. Stress is one of the most significant contributors to tension headaches. When you're under stress, your body releases hormones that can cause muscles to tighten and your pain threshold to decrease. Chronic stress can keep your body in a constant state of tension, making headaches more frequent and severe. Learning to manage stress through mindfulness, exercise, or counseling can help reduce the frequency and intensity of tension headaches. Lack of sleep or poor sleep quality can make you more susceptible to tension headaches. Sleep is essential for the body to repair and recover from daily stress. When you don't get enough rest, your muscles remain tense and your body's ability to cope with pain decreases. Establishing a regular sleep routine and practicing good sleep hygiene can help prevent headaches from developing or worsening over time. Poor posture, especially during long periods of sitting or working at a computer, can contribute to the development of tension headaches. Slouching or holding your head in an awkward position puts extra strain on the neck and shoulder muscles. Over time, this strain can lead to muscle fatigue and trigger headaches. Being mindful of your posture and taking regular breaks can help reduce this risk. Environmental factors such as bright lights, loud noises, or poor air quality can also trigger or worsen tension headaches. These factors can increase stress levels or cause physical discomfort, leading to muscle, tension, and headache pain. Identifying and minimizing exposure to these environmental triggers can be an important part of headache management. Dehydration is a common but often overlooked trigger for tension headaches. When your body lacks adequate fluids, it can lead to muscle cramps and increased sensitivity to pain. Even mild dehydration can cause headaches or make existing ones worse. Drinking enough water throughout the day is a simple yet effective way to help prevent tension headaches from developing. Spending long hours in front of screens can cause eye strain, which in turn can trigger tension headaches. Staring at a computer or smartphone for extended periods forces your eye and facial muscles to work harder, leading to fatigue and discomfort. Taking regular breaks, adjusting screen brightness, and practicing the 20-20-20 rule can help reduce eye strain and prevent headaches. Hormonal changes, especially in women, can influence the development and severity of tension headaches. Fluctuations in estrogen levels during menstruation, pregnancy, or menopause can make headaches more likely. Being aware of these patterns can help in anticipating and managing headaches during certain times of the month or life stages. What you eat can also play a role in the development of tension headaches. Skipping meals, consuming too much caffeine, or eating foods high in preservatives can trigger headaches in some people. Maintaining a balanced diet and eating regular meals can help stabilize blood sugar levels and reduce the risk of headaches. Regular physical activity can help prevent tension headaches by reducing stress and improving muscle tone. However, overexertion or improper exercise techniques can sometimes trigger headaches, especially if they lead to muscle strain. Finding a balance and incorporating gentle stretches or relaxation exercises can be beneficial for headache prevention. Some people may be more prone to tension headaches due to genetic factors. If you have a family history of headaches, you might be at higher risk. While genetics alone don't cause headaches, they can make you more sensitive to common triggers. Understanding your family history can help you take proactive steps to manage your risk. If you notice that your headaches are becoming more frequent, lasting longer, or are harder to relieve, these could be warning signs that your tension headaches are becoming chronic. Keeping a headache diary can help you track patterns and identify changes over time. Early recognition of these signs is important for seeking medical advice and preventing further progression. Diagnosing tension headaches typically involves a detailed medical history and physical examination. Your doctor may ask about your symptoms, frequency, duration, and possible triggers. In some cases, additional tests may be done to rule out other causes of headache. Accurate diagnosis is essential for developing an effective treatment plan tailored to your needs. Treatment for tension headaches often includes a combination of lifestyle changes, stress management, and sometimes medication. Over-the-counter pain relievers can help with occasional headaches, but should not be overused. Non-drug therapies like relaxation techniques, physical therapy, or cognitive behavioral therapy can be effective for chronic cases. Finding the right approach may take some trial and error. Relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation can help reduce muscle tension and stress, both of which contribute to tension headaches. Practicing these techniques regularly can lower the frequency and severity of headaches over time. Incorporating relaxation into your daily routine can be a powerful tool for prevention. Physical therapy can be particularly helpful for people with chronic tension headaches. Therapists may use techniques such as massage, stretching, or posture correction to relieve muscle tension. Regular exercise, including aerobic activities and gentle stretching, can also help reduce headache frequency by improving blood flow and reducing stress. Cognitive behavioral therapy, CBT, is a psychological approach that can help manage tension headaches by changing negative thought patterns and behaviors. CBT can teach you coping strategies for stress and help you identify triggers. This therapy is especially useful for people whose headaches are closely linked to emotional stress or anxiety. Medications such as acetaminophen, ibuprofen, or aspirin can provide relief for occasional tension headaches. However, overuse of these medications can lead to rebound headaches, where the pain returns as soon as the medication wears off. For chronic cases, doctors may prescribe preventive medications or recommend non-drug therapies to avoid dependency. Biofeedback is a technique that teaches you to control certain body functions, such as muscle tension or heart rate, using electronic monitoring. By learning to relax specific muscles, you can reduce the frequency and severity of tension headaches. Biofeedback is often used in combination with other therapies for best results. Making changes to your daily routine can have a big impact on tension headache prevention. This includes managing stress, getting regular exercise, maintaining good posture, staying hydrated, and ensuring adequate sleep. Small adjustments can add up over time and significantly reduce the likelihood of headaches becoming chronic. Keeping a headache diary can help you identify patterns and triggers for your tension headaches. Record when headaches occur, their severity, duration, and any possible contributing factors. This information can be invaluable for your healthcare provider in developing a personalized treatment plan and monitoring your progress over time. While most tension headaches are not dangerous, it's important to seek medical attention if you experience sudden, severe headaches, headaches with neurological symptoms, or if your headaches are becoming more frequent and harder to control. Your doctor can help rule out other causes and recommend appropriate treatment. Preventing tension headaches from recurring involves a combination of lifestyle changes, stress management, and regular self-care. Identifying and avoiding personal triggers, practicing relaxation techniques, and maintaining a healthy routine can all help reduce the risk of future headaches. Consistency is key to long-term prevention. With proper management, most people with tension headaches can achieve significant relief and prevent headaches from becoming chronic. Early intervention, regular self-care, and working closely with healthcare providers are essential for maintaining a good quality of life. Remember, tension headaches are manageable, and you don't have to let them control your life. To summarize, tension headaches develop gradually, often starting with mild discomfort and progressing if triggers are not addressed. Common triggers include stress, poor posture, dehydration, and lack of sleep. Early recognition and intervention are crucial for preventing headaches from becoming chronic. A combination of lifestyle changes, therapy, and sometimes medication can help manage and prevent tension headaches effectively. Let's look at an example. Sarah, a college student, experiences occasional tension headaches during exam periods. Her headaches usually start as a mild pressure in her forehead and intensify if she doesn't take breaks or manage her stress. By recognizing her triggers and practicing relaxation techniques, Sarah is able to prevent her headaches from becoming a regular problem. Now consider John, who works long hours at a desk job. Over time, his tension headaches became more frequent and started lasting longer. He noticed that poor posture and lack of exercise were major contributors. With the help of physical therapy and regular exercise, John was able to reduce the frequency and severity of his headaches. Tension headaches can also affect children and teenagers, often due to academic stress, screen time, or lack of physical activity. Parents should watch for signs such as complaints of head pain, irritability, or difficulty concentrating. Encouraging healthy habits and open communication can help children manage and prevent headaches. In the workplace, tension headaches can be managed by taking regular breaks, adjusting your workstation for better posture, and practicing stress reduction techniques. Employers can also support employees by promoting a healthy work environment and encouraging regular movement throughout the day. For students, managing tension headaches involves balancing academic demands with self-care. Schools can help by providing resources on stress management, encouraging physical activity, and allowing for short breaks during long study sessions. Students should be taught to recognize early signs of headaches and seek help when needed. Having a strong support system can make a big difference in managing tension headaches. Friends, family, and coworkers can provide emotional support, help identify triggers, and encourage healthy habits. Don't hesitate to reach out for help if you're struggling with frequent headaches. There are many misconceptions about tension headaches, such as the belief that they are always caused by stress or that they can't be prevented. In reality, tension headaches have multiple triggers and can often be managed with the right strategies. Dispelling these myths is important for effective prevention and treatment. Ongoing research is helping us better understand the causes and treatment of tension headaches. Advances in brain imaging, genetics, and pain management are leading to new therapies and prevention strategies. Staying informed about the latest research can help you make better decisions about your health. If you're struggling with tension headaches, there are many resources available to help. Support groups, Educational materials and healthcare professionals can provide guidance and support. Don't hesitate to seek out information and assistance to manage your headaches effectively. Tension headaches can develop gradually and become a significant burden if not managed properly. By understanding how they progress and what factors contribute to their development, you can take proactive steps to prevent and treat them. Remember, you have the power to control your health and improve your quality of life with the right knowledge and support.